You're welcome.
I'll be, I just have a brief question because my colleagues have covered most of it. It actually deals with Zone 4, and since Mr. Ricker got dressed up, I figure I might as well bring him up here on television for everybody to be able to see it. Congratulations. Look at that, Mr. Ricker. Yeah, I know. It's,
Very nice
yeah,
outfit.
Mr. Ricker.
Very nice.
Yeah.
You can get good things from the Goodwill.
So we'd received a letter from RCD requesting continued funds to provide technical assistance for county residents on storm damage repair, as well as the resource management programs. Last year, this board allocated money for it under the Zone 4 budget. I did notice it in there, and I wasn't sure if this would be an adverse impact on the Zone 4 budget, but it would be something I think that we'd like to see happen again. They've done a lot of good work. If you could just very briefly address that.
Sure. Yes, they have done a lot of good work that supports what we're trying to do in terms of both watershed management and groundwater management too. We do have the funds in Zone 4 already in the budget that would be available. Some of the costs that we had projected are going to turn out to be lower, so there is money available, and we plan to come back in August to make that allocation. Okay,
so do you need specific board recommendation to come back in August for that recommendation, or you'll just bring it back?
We'll just bring it back.
Thank you. Thank you very much. We'll now open it up for the community. I appreciate everybody's been waiting so patiently here. If you could have any questions or concerns regarding the HSA budget, now would be your opportunity to speak on this budget item. Good afternoon and welcome.
Good afternoon, Supervisors. Thank you for the opportunity to address you here today. My name is Justin Palmer. I'm an organizer with the National Union of Healthcare Workers, NUHW. We represent 14,000 workers across the state, including workers here in Santa Cruz at Sutter VNA, Dominican Hospital, and Janus of Santa Cruz. Janus is the county's leading provider of substance abuse services, which include residential and intensive outpatient programs, methadone clinics, a DUI program, perinatal care, and a sobering center. Last year, the 85 workers at Janus, many of whom are here today, petitioned and voted almost unanimously to form a union. One of the main issues driving their effort to organize was the obscenely low poverty wages, which lead to high turnover at Janus and diminish the agency's ability to provide quality care for its clients. Counselors at Janus providing treatment make as low as $16 an hour, and 75% of the treatment techs there earn a wage below the county's living wage ordinance, which, as you probably know, does not apply to the nonprofit sector. So some of the folks here today are going to speak directly to the issue. I applaud them for being here. Many of them took time out of their schedule to be here from 9 a.m. and are going on their way to work in a minute or two. But the bottom line is this. Workers providing frontline care at the center of the opioid epidemic in Santa Cruz deserve to earn a living wage, a wage that allows them to care for themselves and their families. If we want to be serious about fighting the opioid epidemic in Santa Cruz, we need to be serious about providing the hardworking people who are leading that fight a livable income. Janus receives 70% of its funding from the county. We are here to urge you to increase funding for the subcontractors who make the vital work of substance abuse treatment possible. In short, poverty wages shortchanges substance abuse services. Thank you.
Thank you. Good afternoon and welcome. Thank you all for waiting.
Good afternoon. Thank you. I'm a little sleepy. I worked till 11:30 last night, and I'm going to head back to work here in about an hour. So I hope I can be coherent in my thoughts. I was getting some groceries the other day in Midtown in Santa Cruz, and I parked my car across the street, and I go across the street, and there's a youngster, it looks like a baby, laying on a heap of trash, trying to find a vein to shoot some heroin just right there in the parking lot. And I kind of bent down to him and I said, I'm not trying to talk you into anything here. I said, but there is another way. There's Drug Medi-Cal now, and there's a place called Janus. And when you're ready, come by and see us. And it was just really sad. He looked like a baby. And so I work in that field. And I've been at Janus now for almost 9 years, and making less than $16 an hour. And I've been there for almost 9 years. I don't know what that means, if that means anything. I know that there's been a really high turnover in the last, 90% of our clients, I believe, I don't know if that's a true number, but a large percentage of our clients could be 90%, are drug Medi-Cal clients now, since the waiver went through at the beginning of the year. And along with that, we're getting a higher and higher acuity level of clients, and that's sort of a phrase that's thrown around as far as the complexity of the clients. A lot of dual and multi and poly-diagnosed mental health clients, along with substance abuse. We had a client just recently that had a big cudgel in his hand, almost like a baseball bat, going, "Don't get close to me." And so we're getting those kind of clients, and we're working with those kind of clients. And I had to ask him for his walking stick. And I sat with a girl that came in a week ago that I took kind of through detox, because I've been a medication med tech for the last 5 years, and helped her get her through detox. Oops. And she just said, "Thank you for being so kind." She goes, you seem to know what's going on around here, but not very many of the techs do. And it kind of made me sad, because I have been getting a really high turnover. I think in the last 2 years, we've gone through more employees than in my first 6 years working there, either getting let go or resigning. And I don't know if that's in direct correlation to wages, but I suspect that might be true. And so often I find myself not being able to give services, but having to go and explain to somebody I'm working with what we need to do next, because they've only been there for 2 or 3 weeks, because that person that was there for 4 months quit. That sort of thing. And I don't know if higher wages would help or not. I'm here to report that it's a very sad experience, and also a very rewarding experience, and I love what I do, and I'd like to be able to continue doing what I do and to live in Santa Cruz. Thank you.
Thank you. Good afternoon. Thank you for waiting.
Hi, my name's Jason Rubin. I'm a certified drug and alcohol counselor at Janus. Currently working in the DUI department. Probably I'm one of the senior employees at Janus, even though I've been working there off and on since 1999. I'm also a former patient of Janus. I have a lot of, what can I say, respect and gratitude that they helped me change my life around, and I've been working in this field for quite a while. And we're talking about the low morale that's starting to set in with the huge turnover of employees that we currently have. In the last 2 or 3 years, I've just never seen this kind of turnover. I'm also on the union bargaining team where we're talking about wages. I just want to share with you a little bit about my situation. I am a counselor too, right? And I'm currently working with just about $1 or $2 over the Santa Cruz living wage limit. So I'm making $17.23. Counselor too. I'm working part-time, not the part-time where you get benefits. I'm working under more or less about 18 to 20 hours a week, because in my department they don't seem to be hiring people to work part-time with benefits. So I'm on Medi-Cal now, because I actually can't afford to pay the premiums for Medicare, so I'm on Medicaid. I live in a 22-foot travel trailer. The rent is increasing. I've been living there for quite a while. It's just a real difficult time making ends meet. And Janus, we know, has gotten a lot of money to increase their infrastructure, to expand their infrastructure. They're doing a great job at that. Brand new industrial kitchen. They put in sprinklers throughout the whole facility. They just bought a $60,000 brand new 12-seater van. They just rebuilt the intensive outpatient house, which is a separate little, small house facility. And And I just want to say that there doesn't seem to be money going into
Thank you.
human resource infrastructure, right? People are struggling left and right just to make ends meet.
Thank you. Thanks for sharing that story. Good afternoon. Thank you for waiting.
Hi, my name is Leah. I work at the perinatal facility for Janus. And let me start by saying that I absolutely love my job, but that doesn't make it easy. I work with babies straight out of the NICU who are on morphine doses. I work with women who are directly affected by this opioid epidemic, women on methadone, women working with the methadone clinic and helping administer those doses and whatnot. I feel it's just very complicated for us to continue this work. Luckily, at this point in time, I am not relying on this as a main income. I'm mostly supported in terms of rent and all of those things. But if it weren't for that, I don't think I could continue to work like this. But like I said, I love my job, and that's kind of what keeps a lot of me, and I know a lot of my coworkers, what keeps us banded together is seeing the impact that our work has on these women, and seeing them come back and say, oh, I'm so grateful for the time I spent here. But it's just not necessarily a conducive work environment for some of us. And I would love to preach to everyone that this job is, it's not only rewarding emotionally, but it's also rewarding financially. I would love to advocate for that, but unfortunately at this point of time, there's people that I cannot convince to get into this line of work because of the pay, and I feel that that's why our turnover is so common, and I feel that the turnover in employees has a direct correlation to the turnover of our clients, because they see the disconnect between staff and they see the inconsistencies, and I think that it directly impacts them, because then they're wondering, well, why don't people want to stick around for me? And yeah, I feel that it would just be beneficial to our clients for us to have a lower turnover rate. That's all I really have to say. And thank you for providing this space for me to speak to you guys today. And I know a lot of people have left, but thank you to everyone who has these, who works at these agencies that we tend to see these women working with, such as Families in Transition and, Homeless Health Services and all of that. So thank you.
Thank you. Good afternoon.
Good afternoon, gentlemen. Thanks for your time. Bear with my nerves here. My name is Matt Van Eyes. I'm an IoT counselor, intensive outpatient treatment counselor at Janus of Santa Cruz. 10 years ago, though, my partner and I were homeless on the streets of Santa Cruz for 3 years. We went from sleeping in the bushes of the Red Church downtown to a tent behind Natural Bridges, to finally getting this horrible looking van that was so menacing looking. We called it the 1984 Ford Kidnapper because it was just a real eyesore. And we parked that all around town. I shoplifted from Safeway daily. I ran receipt scams at CVS. I stole personal property from cars. I was in and out of jail on a regular basis. In short, I was a drain on the system, I was a drain on your budget, and I was a drain on the community at large. I wasn't a bad person inside. I was just hopelessly hooked on crystal meth, and I didn't know what to do, and I didn't see a way out. Eventually, my life came to a head, and I realized I needed to change. I didn't know how to do that, so I began that journey as a client of Janus in their residential treatment facility there. At this point, I'm coming up on 7 years in recovery. I'm a contributing member of society. I'm grateful to pay it forward through my work doing IoT counseling. I'm doubly grateful to be expecting my first child in October, along with that same partner who got into recovery as well. The problem is that I can barely make ends meet without a kid, let alone with one. And I don't want to quit my job and my calling because I can't make enough money, and you don't want me to quit. I make a difference out there. I make a difference in everyone's pocketbook as a result. Every addict that enters recovery is money and misery saved. Continuity of care is crucial in this field. Relationships are key to our success, and turnover is the absolute enemy of recovery and the services that we do. And turnover is at an all-time high, and I am certain that it's because of wages. I don't want to have to quit, but I will if I can't make more money and enough money to be able to raise a family. So I'm appealing to you to help us who are committed to creating positive change be able to earn a living wage while we continue to do that and continue to do the good work in the community that we do. And to reiterate what Justin said, poverty wages shortchanges substance abuse services. So thank you very much.
Thank you for sharing that story. Good afternoon and welcome.
Good afternoon. My name is Jo Komatsis. I'm actually a former employee of Janus. I'm one of those people who had to leave for wage reasons. So I worked at the perinatal unit because I do have a Master of Public Health. I have a passion for public health, and I have a real interest in maternal and child health. So I thought this would be the perfect place for me. And in many ways, Janus was the perfect place. I'm also a birth worker, so I could share my birth worker skills and my knowledge of public health and my compassion for women and their children who are struggling in some of the worst times of their life. But in general, my observations about the counselors and the treatment techs, we all greatly enjoy our work. And as treatment technicians, we deliver the vast majority of services that the agency bills for. We handle life-threatening situations, we risk our own personal safety, yet we use impeccable judgment, we cope with verbal abuse, and we're also using different evidence-based treatment modalities to the best of our ability. We're constantly solving complex problems and trying to make the best improvements that we can. And the job duties of the treatment technician have grown immensely, but the compensation has remained stagnant. Most people are starting around $12 an hour at Janus. If you're lucky, you'll make 13 because I had a master's degree. I got to start at 13. McDonald's workers in Santa Cruz start at $11.50. Panda Express cashiers, their starting pay is $13 to $15 an hour. In-N-Out Burger associate pay, $14 an hour, $16.50 after 3 months. And I want to echo the statement by Mimi Hall. The workforce needs to be taken care of, and we need the resources to be successful. And I wish I could have stayed at Janus, but now actually I work somewhere I make almost double what I was making, and I have full benefits. So, I mean, it wasn't really a sound decision for me to stay. I have a son, and as you all know, rent's a little pricey around here. And yeah, it's just really sad, the turnover rate. And I do miss working with my clientele, and I work with a much easier clientele to work with now, but that was just the choice I had to make. And I also want to echo Justin's statement that poverty wages shortchange behavioral health services. Thank you for your time.
Thank you. Good afternoon and welcome.
Good afternoon. Thank you, gentlemen, for being here, board and staff. My name is Stephen Sills, a treatment technician at Janus of Santa Cruz, and I work in the detox unit. Been there a little over 13 years, and I'm also a lifetime resident of Santa Cruz County. So I have seen the cost of living in Santa Cruz County just go up and up and up. I'm very fortunate that I do have a housemate to share expenses with, but if it wasn't for that, I'd probably would be hoteling it or something. I don't know. Even hotels are out of price nowadays. I don't want to make it all about wages, but as expressed by my other workers, the turnover right now is immense. Like, I've never seen it this bad in my 13 years there. We used to have a solid core of counselors, treatment technicians, and we could just count each other. We knew our moves, we knew what was going on. Now it's like you train somebody for a week or two, they're moving to another department, or they're going off to another job, more weight, better pay. And echo other people, it's like continuation of care. We've had clients come back many, many times, and Justin, myself, and Scott are about the only people that are left from a long, way back when. And to come in and see a familiar face just makes it that much easier for our clients and our patients to say, hey, this is a safe place to be. And I make a fairly decent wage, but in the meantime, the cost of living is going up, expenses everywhere are just going up. And right now, it's like, what do I do? Do I get another job? I'm a full-time employee. I don't know if I can do another part-time job. But anyway, thank you for listening. Thank you for being here, and carry on. Thank you.
Thank you. Good afternoon. Thanks for waiting.
Hi, my name is Branch Schmitz. I work at the methadone clinic in town. So there's a theme of just hearing a lot of turnover. And, I've had clients come to me. I get them from another counselor who's left. You're the fourth counselor I've had here. Are you going to leave soon? I say, no, I'm probably going to stick around for a while. We'll see. So it's basically about investing in the quality of care we're giving. That's all it is. And investing in the quality of care, in the counseling and the detoxes, and it can get pretty ugly as far as dealing with some of the mental health and substance abuse clients. There's a lot of strange behavior, and you're investing in counselors who are seeing a lot of that, and to have it so people are sticking around in really difficult work situations. It's hard enough working there. And of course, you see a lot of, there's always something in my colleagues that brings them to this work, and he probably just comes across naturally, but to be able to have that higher income to be able to take care of ourselves is it makes it easier to serve our clients as well. So thanks for listening.
Thank you.
Good morning, turned afternoon. My name is Eggbert Fuerte. I work for Janus of Santa Cruz. In fact, right across the street at the Sheriff's Office Recovery Center, which is not that, it's Janus Sobering Center, but there's a sign out there that says Sheriff's Office Recovery Center. There's no employee there. That's a deputy. We're all Janus employees. I'm an intake referral specialist. We don't get deputy wages. We're not paid by the county. We're paid by Janus of Santa Cruz. My check says Janus of Santa Cruz, yet we still have the sign, Sheriff's Office Recovery Center. It's not ran by the sheriffs. It's ran by Janus. I've been there since day one, June 1st of 2015. Only me and 2 other coworkers remained there from day one. The rest are either within less than a year, 2 years, months working there, and the turnover rate there is high too. Part of the reason we unionize is because of, it's another issue, but intimidation tactics to get people to leave. Like, maybe you don't belong here. If you're not making enough money, why don't you go somewhere else? I was told that. I said, I'm not going nowhere else. You're going to have me here. I don't care if I'm not getting a raise right now, but I'm staying for the long run. We deal with people off the streets that come in arrested. They're coming in handcuffs for DUIs, drugs, alcohol, whatever drugs out there, right? That's what we get them for. Instead of going to jail, they come straight out the cop car into our facility. We accept them. We do an assessment, medical, my coworker, myself. We assess them, make sure they're fit for the program. Sometimes, as soon as the officer leaves, they begin threatening us. There's been times where they've done violent acts, punch holes in the wall, crack the window, and we're told, well, that's part of the job. And we know it is. We know what we're getting into. I have to take another job in order to attempt to support myself and make it here in Santa Cruz. I'm a Santa Cruz native. I was born here. When my parents immigrated here in the late 60s, early 70s, and by the early 90s, they were able to purchase a home. I'm someone that has the opportunity. I can't get a well-paid job. We only ask that somehow you can help out with some grant money toward the Sobering Center, toward Janus of Santa Cruz. We get a high clientele of DUIs that we send to Janus, Maine, so there is money coming in, but we don't know what's going on with it. Thank you.
Thank you. Good afternoon.
Good afternoon, Supervisors and Ms. Hall. Thank you for having us. My name is Sonia Rifkin. I'm a researcher with the National Union of Healthcare Workers. And, the county has already invested considerably in expanding access to treatment for substance use disorders, especially opioid addiction around the county. And as you know, Janus is the focal point for much of that investment, and also the largest regional provider of the kinds of evidence-based treatment that you were speaking to earlier, and the kind of treatment that's at the heart of the drug Medi-Cal locale expansion that's contributing to the $13 million increase in revenues for behavioral health services this year. You know, Janus's Recovery Center, which Edgar works at, is a key part of the county's substance use disorder strategic plan and efforts to divert county resources from being wasted on unnecessary bookings and arrests. Bringing Janus's workers up to a livable wage would cost about $350,000 in the next year, an investment that we're asking the county to make, which would have a significant multiplier effect. The supplemental budget for this year shows Janus's contract is unchanged from last year, unlike in years past when it's increased, and we're urging the county to work with us to get creative and support these critical services and the people providing them. As everyone's spoken to much more eloquently and personally than I can, you know, Janus's ability as an institution to meet the demand for services depends on having a consistent and experienced workforce. Folks are making $12, $16 an hour. The turnover rate that people are talking about was nearly 40% in 2016, and by our math likely cost Janus upwards of $250,000 that year. And that's equivalent to the entirety of the contract the county has for their detox services, for some perspective. You know, we know there's a great demand for these services. By one estimation, there's 1,500 people who are ready and willing to receive treatment if they were able to, if there was enough providers. And untreated substance use disorders cost the county upwards of $200 million a year in criminal justice costs, the cost of auto accidents, things like that. You know, investing in these frontline workers is considerably more affordable than all of that. You know, Janus operates financially like many nonprofits with small profit margins. By the last count, over 60% of the county's nonprofit subcontractors had been able to pay a living wage, and we know that Janus can do the same with the county's support. Folks, the 2,500 clients who come to Janus each year deserve consistent, high-quality care. Most people in this county have been touched by substance use disorder in one way or another, and as you've heard over and over again, you know, folks deserve the best care we can give them. And again, as you've heard, these poverty wages are shortchanging behavioral health services, and supporting Janus workers is a critical step. Thank you. And we have fact sheets for you all.
Thank you. Is there anybody else that would like to address us? Okay, seeing none, we'll bring it back to the board for action on the Health Services Agency budget. Supervisor Leopold.
Thank you, Chair. It was a great presentation. We also heard powerful testimony from people who are on the front lines of the epidemic. I would move the recommended actions for the Health Services Agency budget, and I'd also like to add one additional direction to get a report back at our next board meeting about what the state of the negotiations are between Janus and the NUHW.
I'll second that, and yeah, thank you for both the presentation and thank you for the folks who are doing the important work to make the difference in our community.
We have a motion and a second. All those in favor?
Aye.
Aye. Opposed? It passes unanimously. We do have one more item before we recess, which is just oral communications. Is there anybody from the community that would like to address us on items that are not on today's agenda but within the purview of the Board of Supervisors? Okay, seeing none, we will recess until 7 o'clock. We will be here to take additional testimony on the proposed budget here in the Board of Supervisors again at 7 o'clock. We'll recess till then.